Hello one and all. Today we're going to discuss about the topic of biomechanics of knee joint. So these are the contents to be discussed: tibiofemoral arthrokinematics, tibiofemoral osteokinematics, automatic locking, or screw home mechanism, or said to be as phenomenon. So coming to the osteokinematics of knee joint, there are 2 degrees of freedom of motion, as we all know. So the first one is flexion extension, which is done in coronal axis. The second one is internal or external rotation, which is done in vertical axis. The other one is passive frontal plane motion. And coming to the flexion, so as we all know, in normal our flexion degree of knee is 130 to 50 degree, whereas in squatting it is 160 degree, whereas gait, that is during walking, it is about 60 to 70 degree, whereas in ascending stairs, that is moving upward in stairs, it is about 80 degree, whereas in hyperextension it is 5 to 10 degrees. So this is nothing but a picture representation of the flexion and extension of degrees, which we have been discussed before. It is nothing but evolute, that is done in migrating axis, that is flexion of femur over the tibia. Yeah, here comes the axial rotation and valgus and varus. Coming to the axial rotations, at 90 degree of flexion, medial rotation will be contributing to about 0 to 15 degree, whereas lateral rotation contributes to about 0 to 30 degree. In extension, 6 to 7 degrees, that is only done in passive, with 20 degrees of knee flexion, that is equal to 13 degree. In axial rotation increases with knee flexion, and total rotation in 90 degree of flexion, 40 to 45 degree. External rotation to internal rotation ratio is about 2:1. Naming the rotation is done on the basis of the rotation in orientation to the tibial tuberosity. This is nothing but the picture presentation of the stuff we have been discussed before. That is, naming the rotation is based on the orientation of tibial tuberosity with respect to the distal anterior femur. And it also varies from age. That is, it depends upon age and gender as well. This is nothing but the rolling of femur over the tibia. Yeah, here comes the first picture represents the posterior roll and anterior glide of femur on tibia. This one, and whereas the second picture represents the anterior roll and posterior glide of femur on the tibia. This is nothing but tibia on femoral extension. This is tibia on tibial extension. And this is nothing but roll of cruciate ligaments and flexion and extension, that is ACL and PCL. Yeah, these are the ligaments, that is anterior cruciate ligament, medial collateral ligament, posterior medial capsule, oblique popliteal ligament, which is being viewed in the medial view. Coming to the locking and unlocking mechanism, locking full extension requires 10 degree of external rotation. It increases the joint congruency and stability. Yeah, this is nothing but the representation of that is lateral epicondyle, medial epicondyle, and intercondylar groove of the femur. When it is fully extended, it comes to the level of this, whereas in 30 degree of flexion, 60 degree of flexion, and 90 degree of flexion. Yes, automatic on terminal rotation. It is nothing but coupled motion of lateral rotation and extension of knee. It is automatic, locks the knee joint, keeps knee to remain in full extension in standing. Yeah, during non-weight bearing, this is nothing but very simple. The anteroposterior diameter of lateral femoral condyle is greater than medial femoral condyle, as we all know. And during last 30 degree of extension, glide and roll in lateral condyle finishes, but not in the medial condyle, as we discussed before. And lateral condyle serves as an axis of medial condyle backwards. That is, lateral rotation of tibia on femur will be happening. And during non-bed bearing, this is the locking of knee or screw home phenomenon. Locking makes all ligament taut, as we all know. So coming to non-bed bearing, that is unlocking. Knee flexes only if unlocked. It happens with medial rotation of tibia on femur. Unlocking is brought about by the popliteus muscle. So locking, femur rotates medially on relatively fixed tibia during last 30 degree of flexion. In unlocking, lateral rotation of femur on tibia before flexion proceeds. So the factors guiding screw home rotation is nothing but the shape of the shape of medial femoral condyle, the tension in ACL, lateral pull of the quadriceps muscle. These are the references that I've took. Thank you.